There's a whole area of science we call community-based participatory research, and that is just another way of trying to involve the community very actively in the research process. And it makes a lot of sense, but it's not how we've always done science. And so what it really tries to do is bring the community as an active, equal partner into thinking about important research questions, developing research plans, implementing them, rolling them out in the community, working and partnering with community-based organizations so that the whole community can benefit from whatever we learn, from whatever we're doing. It's particularly relevant if people are interested in public health issues. Well, again, I have additional training, not just being a doctor, but thinking about public health. And so a lot of the research I do thinks about health at the community level. And so it's really important to have community partners. So the two things that I think about most as a physician and researcher are women's health and then diabetes. I particularly think about diabetes because it's something that really affects the African American community. And again, most of my work is around how patients and doctors talk to each other. And when you have diabetes, you think about your diabetes every day. You go to see your doctor a lot because you're needing to have your medications adjusted, having your feet checked, having your eyes examined. So you're always in and out of the healthcare system and really talking to your healthcare team a lot. And so I really think about how to improve diabetes care and people who have diabetes, how to improve their health. So I have Sisters Working It Out, which is this nonprofit group that does a lot of community-based education, outreach, and advocacy around breast cancer. And we also have some work that's based at the University of Chicago, where I work, around diabetes. One of the community-based diabetes projects I have really is trying to think about diabetes disparities in a holistic way. So meaning that African Americans have diabetes, much more likely to have diabetes than people who aren't African American. And we're much more likely to have complications, have blindness, be on dialysis, have your foot cut off, all these kinds of things. There are also things that kind of go with diabetes. So people who have diabetes are more likely to be told they have high blood pressure, high cholesterol, they have heart disease. All of these things are much more prominent in the African American community than other communities in this country. And so to fix that problem, we have to do a lot of different things. So we can't just think about patients, we have to think about doctors, we have to think about health systems, we have to think about communities. And so one of the big projects I'm working on now is a diabetes project that's based here on the south side of Chicago, which is primarily African American working class communities. And so we have various classes for patients, patient empowerment classes to help them talk to their physician better and help them know more about their diabetes and how to take care of it at home. We have things for physicians where we do additional training for doctors and healthcare providers. We're working with 6 clinics in particular, 4 of which are what we call community health centers or federally qualified health centers. So they're clinics that really focus on the health of people who don't have a lot of money or may not have insurance, which people who are Black are more likely to be in that category. And so we're working with those clinics to help them think about how they're delivering care for people who have diabetes in new ways and better ways. They can streamline things and take better care of their patients. And then we spend actually a lot of time thinking about how we work with community organizations. And so I'm on TV a lot and on the radio a lot talking about diabetes. We're forming a lot of partnerships with grocery stores, with fitness centers, with community resources so that people can know about these programs so that they can give our patients a discount so that our clinics can integrate what they're doing with some of these organizations and our patients. We're really trying to think about the problem from all angles.